what was interesting, we collected these three farrowing rooms, and they had different proportion of positive piglets, so different positivity in these three rooms. Let's say room A, B, C, for example, and this is an interesting result because we can see the dynamics of influenza.
Welcome to the Swine Health Blackbelt Podcast, the latest swine health research digested for you. My name's Dr. Clayton Johnson. I'm the host of the podcast. Joining me on this week's episode is Dr. Daniel Moraes. Dr. Moraes is a Ph.D. candidate at the Iowa State University College of Vet Medicine, working with the Field Epi team. Daniel, thank you so much for being here and joining us on the podcast. Why don't you give the audience an introduction and give them a little background on yourself?
Thank you, Clayton, for the introduction, and thank you for this opportunity to sharing here our research. So, I got my DVM in Brazil. I'm from Brazil. I worked as a swine veterinarian there for about 8 years in a technical and commercial position. I came to Iowa State in 2021. I got my master here, currently doing my PhD, and also I am a real pork scholar from National Pork Board since the fall last year. And thanks again for the opportunity of being here.
Farm Health Guardian is a proven biosecurity software system that helps you improve compliance and reduce disease risk. Why choose Farm Health Guardian? Automate downtime and health status management for large systems. Get biosecurity breach alerts for trucks and trailers. Prevent unauthorized access to your barns with controlled entry technology. And speed up disease investigations with automated traceback reports. Check out what our customers are saying at farmhealthguardian.com.
Well, it's fantastic to have you. I know, Daniel, you have had a project going on with influenza surveillance, and certainly influenza has been the talk of the livestock world over the last couple of months. Fortunately, not so much on the pig side, all right? But everybody in the barnyard group has been aware of influenza because of the dairy outbreaks that we've been seeing. But Daniel, why don't you talk to us a little bit about your project? What are you working on specifically with influenza surveillance?
Okay, so yes, that's a good question. So basically, the main I would say two goals that I have been researching. One is in diagnostics, one of the focus, and one is on surveillance. So, talking about, I will mention a study that we have been doing and also some examples that we have been observing in some farms, and it's very, I guess, applicable. So, the one of the studies that we did is we had a question about a sample type for influenza A virus. So basically, in 2015, there was a sample type called nasal wipes. That's a very good sample type that came. And in 2019, there was a sample type called other wipe that has been used and also a very good sample type. And also, we had a work that was done in 2021 that is called Family Oral Fluids. That's a population-based sampling, the same as other wipe. And we had but this sample type was tested for PRRS virus. And we had a question, how about for influenza A virus, especially talking about family oral fluids? Because sometimes what I heard is only oral fluids in the farrowing room and not family oral fluids. And that's why we had that question. Okay, how about a study to understand how it would perform for influenza A virus? And that's how the question came. Like we thought, well, it's family oral fluids comparable for like to other wipes, for example, just thinking about population-based sampling. And so with that, we did a study. We compare different sample types to see probability of detecting influenza A virus. And moving just for the results was very interesting because family oral fluids had good results. I would say a comparable result with other wipes, for example. At that study, we used the nasal wipes as an individual sample type, just to as a reference. And well, also what was so first, yes, familiar fluids had a comparable and interesting result, but also other wipe has also good result. As in these two is important to mention that they are population-based sampling. So we are testing a group of animals at the farrowing room, differently on the nasal wipes where we are testing the individual animals. In these studies, just important to explain that we tested all of the piglets in all the liters just to understand the proportion of positive piglets within the litter. Also, just to understand at that time the dynamics of the virus. And what was very nice from this study is that we went in 3 breeding herds at the same day in 3 groups because we needed to have the evidence that the virus, influenza A virus, is very dynamic. Sometimes you may detect, sometimes not. And we need to be sure at that time if the virus was circulating. And we went in these 3 groups, tested, we collected the samples, we tested the same day at the university. We collected other wipes to do the screening. We tested here, and one of the farms was positive, and we came back in the full group in this the positive farm 2 days after, and we collect all of the samples. So just it's just important to explain that to be able to perform and to be sure that we will be able to compare those samples at this farm. And also, what we did in this farm, we collect samples from 3 different rooms at the same day. And what was interesting is that those 3 rooms, they were the animals, they were in the weaning age. I mean, 17 to 21 days. So animals getting ready to be weaned. And what was interesting, we collected these 3 farrowing rooms, and they had different proportion of positive piglets. So different positivity in these 3 rooms. Let's say room A, B, C, for example. And this is an interesting result because we can see the dynamics of influenza. For example, one room was very many stalls our rates were positive. The second room, we had some quite positivity, but in the last, we had only one positive rate. So can you imagine? Okay, I am testing flu. I am. Oh, if we think about in the field in a day by day, right? So let's say I'm testing, and if I test in this room that okay, I'm seeing some clinical, but I was not able to get the a positive sample. So maybe I went in the third room. But if I was lucky, maybe in the first or second room that I had more virus circulating at that time. Oh, good, very good. Yes, like I thought the virus was, I thought that was influenza or some respiratory pathogen. And yes, I got. So it really depends from so many factors, right? When we think about influenza virus. But this was one interesting aspect of this study to see this difference of positivity between rooms. And another take home from this study, I would say that uh, population-based sampling, like familiar fluids or other wipe, they were more cost efficient for influenza testing. So when we talk, for example, in this case about influenza virus, uh, uh, our goal of testing may depends on your purpose, right? If you are want to elimination, control, or just have a positive, or anyways. But it's interesting because when we think about population-based sampling, it improves. It's a good option for practitioners, for veterinarians, producers. Think about cost efficient. So I mean, to improve coverage and improve number of animals and reduce cost of testing, because in the end of the day, if you can save money as a producer or as a veterinarian, and also be comfortable that you will have a positive result, or at least confident in the approach that you're using, this will be it will bring a good perspective for you. So yes.
Salmonella presents significant challenges to pig health and performance and poses food safety risks to humans. As the first and only vaccine offering live attenuated strains of both Salmonella cholerae and Typhimurium, Enterosol Salmonella TC from Boehringer Ingelheim protects pigs against both serotypes with a single oral dose. Talk to your Boehringer Ingelheim representative to learn more.
Thanks, Daniel. That's tremendous information on your project. Really appreciate you sharing with us the work you're doing on influenza surveillance as it relates to family oral fluids and how they compare to our other options, our udder wipes, our nasal wipes, etc. Really appreciate you coming on the podcast. And to our audience, thank you very much. This is part one of a two-part series with Daniel. He's going to come on next week as well and talk to us about the practical application of this information. So how much time does it take to collect family oral fluids compared to our other options? How easy is it for the farm? And certainly the cost side of it. How many samples should we collect? Daniel will come back next time and we will go a little bit deeper into the world of influenza surveillance. He'll give us some practical tips on how to translate his research into your farm operation. Thanks very much for joining us. If you haven't subscribed to the podcast, please take a moment to do so. If you enjoy the podcast, please share it with somebody. Share it with somebody you think may enjoy this sort of information and would like 10 minutes of swine research showing up in their podcast feed every single week. Please check out our website, swinehealthblackbelt.com, if you haven't. It's been a pleasure to have Daniel on. And for Dr. Daniel Moraes, I'm Dr. Clayton Johnson. Thanks for joining us on the Swine Health Black Belt Podcast, and please have a great rest of your day.